One of the largest healthcare systems, Ascension, is dealing with a cyber attack. We're going to get into it in today's video. What's up, everyone? Again, it's Brian from Exact IT. Remember to like the video, subscribe to our channel. We're going to get into what's going on at Ascension. I started seeing a little bit of buzz about this when I was doing my YouTube video recordings yesterday, but I couldn't find any concrete proof that there was something going on. I just noticed some certain patterns in some certain places that I researched where I was noticing that this healthcare system might be having an issue. And here we are today, we're finding out within the last 24 hours. It is May 9th, 2024. And we learned that Ascension is definitely dealing with a cyber attack. So according to Wikipedia, Ascension is one of the largest private healthcare systems in the United States, ranking second in the US by number of hospitals as of 2019. And it was founded as a nonprofit Catholic healthcare network in 1999. Ascension also runs a pharmacy system as well as delivery under Ascension RX. By the end of 2021, Ascension had 142,000 employees and 142 hospitals and 40 senior living facilities across the United States. So, wow, we're going to be talking about a lot here. This is a massive healthcare organization. We're going to have patients that are impacted by this. We are also going to see employee information along with private health information potentially at risk here. When you have 142,000 employees, that's a lot of Social Security numbers. That's a lot of private information above and beyond medical records that could be at play here in terms of what this cyber criminal group has taken from this hospital in the midst of this ransomware attack. We don't know as of yet who is behind this, but we certainly do know, according to the videos that I just recorded yesterday that are probably not released on the channel yet, but are coming very soon. So check those out. Lockbit just had a major issue with them, and you can learn about what happened with Lockbit. I'm not saying Lockbit is behind this, but them and AlphaV and Black Cat love to go after these healthcare networks. So let's take a look at what could potentially be the early impacts or the early reports that we're seeing for what is happening over at Ascension. So let's dig into that a little bit. First is we're seeing reports from all over the country, which makes a lot of sense since this Ascension Catholic healthcare system operates in 19 states and Washington, D.C. You're talking about 19 out of 50 states that are going to be impacted in some way, shape, or form in their healthcare system and what's being delivered to them. So we're going to see widespread reports of patients and employees of hospitals being impacted as a result of this. It'll also be very interesting to see if this hospital is only been affected in certain areas, as early reports are saying that this is pretty widespread, which is very eye-opening that a organization like this would be so vulnerable to such a widespread attack. This is why things like network segmentation and segmenting are critical so cyber criminals can't take down your entire organization. And it's very feasible to do today. So I'm surprised that things like this are still happening. So let's dive into some early reports of patient care that's being impacted. We have a story out of Detroit where a patient who was suffering internal bleeding as a result of a potential cancer diagnosis or re-emergence of his cancer. He went to the ER to get help and treatment for this, and he said he walked into what he described as utter chaos as nurses and doctors were running around trying to figure out how to deal with the influx of patients while their computer systems were down. They said that they were trying to find paper charts or work off paper, but he said it was utter chaos. And one of this patient's concerns was actually his personal health information. He was trying to find out from the hospital if his health information was at risk. And he said that the response from the hospital was basically that he was met with the fact that they were just brushing it off because it seemed such a frivolous and trivial issue to them, considering that they couldn't even deliver care to people with even life-threatening injuries. They couldn't deliver care to anybody at this point. So their focus is on getting the hospital back up and running so they can operate and help people. And this guy wants to know, hey, I get that I'm not going to get help with my cancer issue right now, but what about my health information. Is that okay? He's going to learn that in the next several weeks and months as this moves into the recovery phase and they try to figure out what happened. And more than likely, he's going to find out that his private health information more than likely was somewhere in this hospital's network, whether it was in the electronic record system that they have or not. We see a lot in the healthcare world. We see medical records kind of what we call leakage. It means that like somebody will take it out of the EMR system or the EHR system and put it in an email, or they'll save it on the computer, or they'll download it and it'll be in a spot on the computer where a user might not know to look. A temporary spot, maybe in the recycle bin, or maybe you even deleted the recycle bin, but the file just still exists somewhere on the system. It's how computer works really, but people just don't realize it. And there's pieces of healthcare information are the things that hackers find when they do things like this, but don't actually get access to the electronic health records system itself. So that's how these cyber criminals get to these health records without actually breaching medical record system that a entity might have. And according to multiple reports that I've seen, they're saying that this has impacted 140 hospitals and 40 senior living facilities, which would basically mean their whole entire fleet of hospitals and facilities were impacted, which is really mind-blowing that cyber criminals were able to achieve this level of a widespread attack on an organization like this. These things shouldn't be happening today, folks. So when I talk to CEOs and when they say to me, hey, we're good, we have good cybersecurity, these are the things that we're talking about. These are the things that we're trying to uncover for companies. You don't know what you don't know, and you have to admit that. Getting other perspectives, especially independent third-party people who have no skin in the game, to tell you what the real threat landscape is to your organization is critical today, because the minute cyber criminals are getting into your networks, they're figuring out how to do the most damage. And look, this is very much a geopolitical game right now. The feds and the world authorities that are trying to bring these guys to justice, they are at war. It's a tit for tat game, and the businesses of the United States and other countries are the pawns in this game that is being played between law enforcement and criminals right now. And I don't think businesses really understand that, and things like this are going to prove it. And people need to wake up and understand that because businesses aren't doing enough to protect their data, your private health information, your employee records, your employer is basically giving away your private information to criminals, which means for you in the future, you're going to be dealing with things like identity theft, fraud. We see it with healthcare fraud. We see it with credit fraud. We see it with bank fraud. There's all kinds of different schemes and scams. There's criminals out there that are using your information, your children's information when they hack schools and universities. This is all happening. It's all real. Just get yourself a Tor browser and go on the dark web and see for yourself. You don't have to take my word for it. There's other reports out there that also say that the hospital noticed unusual activity on its network on Wednesday, and today is Thursday. I think it was probably a little bit before that these guys were in there, unfortunately, and that's another huge red flag. But their statement is interesting because it says our care teams are trained for these kinds of disruptions and have initiated procedures to ensure patient care delivery continues to be safe and as minimally impacted as possible. We have notified the appropriate authorities, are working to fully investigate what information, if any, may have been affected by the situation. So we're not going to know that last part for a while, number one. And number two, there are so many reports already in the first 24 hours that it says their care teams are trained for these kinds of disruptions. There are plenty of stories already hitting the internet where that is not the case, unfortunately. So you may think you're prepared, you may think you're doing things, or you may have some kind of a plan in place, but you're only going to find it out when you test it. If you haven't tested it, you're only going to test it when you have an event like this. So in other words, it's critical for businesses to do response planning, business continuity planning. Part of that planning is testing and making sure that your plan will actually work and cut the mustard should you actually have to go through an event. Well, that's what Ascension is going to find out today. So that's the breaking news. Ascension Healthcare is dealing with a ransomware attack. We're going to learn more in the coming days, and we'll certainly bring you an update on this. We're going to tell you who's behind this and what the impacts were to Ascension. And we're going to do lessons learned breakdown like we do on this channel all the time as we evaluate cyber attacks. I usually do several follow-up videos when these big events like this happen. So stay tuned. Make sure you subscribe to the the channel and hit that notification bell if you want to be alerted when I update everyone on what's happening with Ascension Healthcare, one of the largest healthcare systems in the United States, hit with a ransomware attack Wednesday, May 8th, 2024. Stay safe out there, everyone. I'm Brian. We'll see you in the next video.